The first thing to make a distinction between is social distancing and self-isolating. People are asked to self-isolate if they're displaying flu-like symptoms, which is defined as a fever or a persistent cough. If anyone in your household has this, everyone living there must stay at home for 14 days, and that does mean cutting yourself off from the rest of the world. Now, social distancing is slightly different. It means trying to avoid contact with other people, and the government are asking everyone to do this, particularly here in the capital, where we're 2 weeks ahead of the rest of the country with the spread of the virus. But most of all, people with underlying health conditions and those over the age of 70 are being asked to take extra care. Now, we heard the Prime Minister saying if you are somebody who has a flu jab as an adult, then you fall into the at-risk group. But to be clear, those in that category are people with a respiratory disease such as asthma, chronic heart, liver or kidney disease, a chronic neurological condition, those with type 1 or 2 diabetes, if you have problems with your spleen, those with a weakened immune system from treatment, those seriously overweight, and finally, if you are pregnant. Now, people who have clinical conditions are at a higher risk of developing serious illness from COVID-19, and they're going to be given further guidance from the government in the coming days. But it is currently people in that category who are told rigorously to follow social distancing advice. So, social distancing means many things for all Londoners. Everybody is being advised to work from home where possible and avoid non-essential use of public transport. Now, people are also told to avoid gatherings in public spaces such as pubs, cinemas, restaurants, theatres, bars and clubs. You're also asked to avoid gathering with friends and family and use remote technology to keep in touch instead. Now, at this stage, the government say this advice is likely to be in place for some weeks.